Hi everyone, welcome back to my channel, and in this video I will teach you about congenital syphilis. Now there are so many people who message me regarding how can we easily remember the early stage feature and late stage feature of congenital syphilis. So I have collected these diagrams from the internet so that you can easily remember the early stage feature and late stage feature of congenital syphilis. Now why I am discussing congenital syphilis? Because congenital syphilis is so many times asked in FMGE examination and NEETPG examination. So if you are a FMGE aspirant or NEETPG aspirant, please listen to this video carefully and you will have a great medical knowledge from this video. So first, congenital syphilis in the early stage. So when the congenital syphilis is in the early stage, that is first 2 years, what we get a patient. Let me tell you the description of the patient. Remember, we get a patient with distended abdomen, and why this distended abdomen is there? Because the patient is having hepatosplenomegaly, and along with that the patient will be having rhinitis. Remember, what is rhinitis? Inflammation of the nose, that is rhinitis, and this is known as syphilitic rhinitis, and this is known as snuffles. So what is snuffles? Snuffles are nothing but syphilitic rhinitis. It is just like a common cold. It occurs just like a common cold, but what happens in case of the congenital syphilis rhinitis, we get more severe symptoms. That is, it looks like rhinitis, it looks like common cold, and that rhinitis is more severe. So always remember snuffles or syphilitic rhinitis, remember rhinitis, along with abdominal distension. Why abdominal distension? I told you, hepatosplenomegaly, that means liver enlargement and spleen enlargement, so abdominal distension and rhinitis. Not only that, the patient will also show you some rash will also be there, because the treponema pallidum will be there inside your body and it will create rash. So very important is rash. And sometimes we get this picture which is there, the vesicular and bullous eruption. Can you see the picture? Vesicular and bullous eruption of the feet. You can see in feet and other portion of the skin you can get vesicular and bullous eruption. Another thing which we can get in early stage is bilateral destruction of medial tibial metaphysis. So you can see this is the tibia bone. On the right side picture you can see the tibia bone, and there is bilateral destruction of the medial tibia. Which portion? Medial tibial metaphysis. So metaphysis portion of medial tibia, destruction. Remember, metaphysis portion of the medial tibia destruction. So what are the things we can get in the early stage of the congenital syphilis? Let us sum up. First is abdominal distension. The patient will come with abdominal distension. That means the patient will show hepatosplenomegaly. Along with that, the patient will also show rhinitis. You can see the picture, snuffles. That is rhinitis. What is rhinitis? Rhinitis is actually inflammation of the nose, and basically you can get just like the symptoms similar to that of the common cold. Along with that, you will get rash, sometimes you will get vesicular bullous eruption, and you will get bilateral destruction of medial tibial metaphysis. Which portion? Medial tibial metaphysis portion. Remember, so these are all the early feature. Now what happens in the late feature? What happens in the late congenital syphilis? In late congenital syphilis, you get the triad, and this triad is very important, known as Hutchinson's triad. Remember Hutchinson's triad. That is the feature of congenital syphilis, late congenital syphilis. When it is late congenital syphilis, you get the Hutchinson triad. What are the things we get in Hutchinson triad? 3 things are involved. Always remember, 3 things are involved. One is the teeth, another is the eye, another is the ear. So teeth, eye and ear, teeth, eye and ear, teeth, eye and ear. So what kind of teeth you will get? You can see the shape of the teeth, that is known as Hutchinson incisor. So it is just like this. Look at the picture below, left side. The Hutchinson incisors are shown, and along with that I have marked it also. You can see how it looks. The teeth will have a specific W shape. You can see the W shape of the incisor. That is Hutchinson's incisor. That is Hutchinson's teeth. Hutchinson's incisors teeth. Now what we get in the eye? We get interstitial keratitis. We get interstitial keratitis. We get IK, interstitial keratitis we get. And what happens to the ear? We get sensory neuronal deafness. So always remember, it is SN deafness, sensory neuronal deafness. Congenital syphilis, what kind of deafness? Sometimes they ask you what kind of. Is it a conducting deafness or sensory neural deafness? In congenital syphilis, it is sensory neuronal deafness. It is sensory neuronal deafness. Remember, SN deafness, sensory neuronal deafness. So three things are involved in Hutchinson's triad in the late stage of the congenital syphilis. What are the three things? The teeth, eye and ear. Teeth, eye and ear. In teeth we get a specific kind of Hutchinson's incisor, Hutchinson's teeth. And in case of eye we get a keratitis known as interstitial keratitis, and in ear we get sensory neuronal deafness. We get SN deafness, sensory neuronal deafness. Remember, it is not conducting deafness, it is sensory neuronal deafness. So always remember these two, the early features and the late feature. In early feature we get hepatosplenomegaly, snuffles, which is rhinitis, and we get rash. And in case of late feature we get all the Hutchinson's thing. So in late is Hutchinson. Remember, late is the Hutchinson. Hutchinson has triad. Remember, triad. What are the triad include? What are the things that are included in the triad? One is the incisor, that is the teeth, eye, that is the keratitis, interstitial keratitis in the eye, and the ear, that is sensory neuronal deafness, that is SN deafness, sensory neuronal deafness. Now let me show you this picture also, because so many people told me that you do not show pictures, sometimes it is difficult for us to read. So I am showing you pictures also. These are image based questions or IBQ that are asked in NEETPG and FMGE examination. So it is very important about the congenital syphilis. Remember the left side picture, the huge one where a child is crying and some secretion are coming out from the nose. That is very important for congenital syphilis spotter. Remember, congenital syphilis spotter, that is actually showing the rhinitis, and what are the other things? What is the feet showing? The feet and the hands, these are showing actually the maculopapular rash. Basically it is showing the vesicular rash. You can see how the bullous rash is there, and the bullous skin eruptions, basically you can say bullous skin eruption is there. And what kind of nose is there? Very important. Do you know what kind of nose is there in congenital syphilis? Do you know that? What kind of nose? It is saddle nose. Yes, saddle nose. You can see the middle picture, that is of the nose. They are showing the saddle shaped nose. Very important. Saddle nose. Sometimes they give you the picture of the nose and they will ask you what kind of nose is this? This is saddle nose, and it is found in congenital syphilis. So you have to understand this is saddle nose that is found in the congenital syphilis. And what happens to the ear? We already know that sensory neuronal deafness. Sensory neuronal deafness. Always remember sensory neuronal deafness to the ear. And what happened to the eye? Remember, keratitis. And what kind of keratitis? Interstitial keratitis. Interstitial keratitis. Remember, all these pictures are spotters for the congenital syphilis. If you are preparing for FMGE examination, or if you are preparing for the NEETPG examination, please subscribe this channel. This channel contains so many medical videos. All these videos I will discuss only those topics which are repeatedly asked in the examination. So if you want to score high and if you want to pass examinations, all this examination, please subscribe this channel. Thank you. Have a nice day. Bye bye.